thank you for joining us this afternoon to talk about advances that can help improve firefighter health and performance. I'm Melinda Villagran, Director of Texas State's Translational Health Research Center, and I would like to welcome you to this webinar. We're really excited about this event and our work in the area of helping firefighters be more resilient. Our center is committed to building resilience in Texas, and we know for sure that resilient communities require resilient first responders. Through our center, we've been working to sponsor evidence-based research that will help us better understand and implement programs that can help Texans be more resilient, including firefighters and other types of first responders. We want to make sure that everyone is able to prevent, adapt, and recover from events that might threaten your health or economic vitality, professional opportunities, and the livelihood in thriving communities across Texas. It's really important to think about this issue in relationship to a statistic that you might have heard before, that the National Institute of Occupational Safety and Health says that sudden cardiac death represents the most common cause of a firefighter fatality. Other types of on-the-job events don't compare to the effects of sudden cardiac death. But luckily, recent advances in personalized medicine offer us new opportunities to tailor specific physical conditioning and wellness that can help to address these problems and reduce the risk of heart disease for individuals through actions that they take on their own, through community action, policy, and things that happen within individual organizations. We're thrilled today to have with us Dr. Matt McAllister, a Texas State faculty member and fellow for Community Health and Economic Resilience Research at Texas State, along with Dr. Steve Martin from the Huffines Institute at Texas A&M. We're seeking today to learn from them and to hear from you as well, because we think it's really important to have a real honest dialogue about what is the situation related to cardiac events among firefighters. How do we address the most pressing risks that are achievable to reduce this problem? And then what steps can we take moving forward to work together to implement the things that we know could really help to address this problem? I'd like to turn it over now to Dr. Jessica Schneider. She is the director of our Community Health and Economic Resilience programs at Texas State, and she is going to give you the rundown of exactly how this event will go and give you some more information. Thank you so much again for joining us, and turn it over to Jessica.
Right, thank you, Melinda, and welcome everyone to this webinar today. First, I want to just very quickly share, my name is Jessica Schneider, and I'm the director of our Community Health and Economic Resilience Research programs here at Texas State University. We're so glad that you could all join us today to learn more about Dr. McAllister's research, his collaborative work with Dr. Martin at the Huffines Institute at Texas A&M, and their combined efforts to improve the health and performance of our first responders, and in particular, our firefighters. Very quickly, to walk you through our agenda, after we conclude our introductions, I'm going to pass the baton to Dr. McAllister, who will discuss the implications of environmental, physical, and psychological stressors in fire service. He will share information about the effects of these stressors on the body and the actions that individuals can take to help mitigate these effects. Dr. McAllister will then hand off to Dr. Martin, who will share his experience working with the Bryan Fire Department to conduct annual health and fitness testing. Dr. Martin will highlight the types of clinical testing services that the Huffines Institute provides and share information for fire departments who might be interested in annual health and fitness assessments. We will then move into our Q&A, where you all will have the opportunity to ask questions of our speakers. We ask that you please submit your questions using the Q&A feature at the bottom of the Zoom screen. You can submit questions at any point during the presentation, and we ask that you do so you are just submitting them as your questions come to you. We will collect your questions and ask as many as possible during the Q&A. I'll also add that you can submit questions during the Q&A itself, but just note that you are encouraged to submit them at any point during the presentation. So without further ado, I will now turn it over to Dr. McAllister to start our presentation.
Thank you, Jessica. Thank you, everyone, for joining this afternoon. I really appreciate you taking the time to be here today. We will do the best that we can to give you the most amount of information possible in the amount of time that we have. I'm going to start by doing a brief background on myself. I think it's really important that you know who you're getting your information from. So I'm an associate professor and the director of the Metabolic and Applied Physiology Lab here in the Department of Health and Human Performance at Texas State University. The first thing I want to say about myself is I am not a firefighter. However, I have been working with multiple fire departments for the last 10 years or so, and my team and I have conducted numerous interventions. Primarily, we have done dietary or nutritional and exercise training interventions in firefighters to assess the effectiveness in terms of the ability to improve occupational performance and improve markers of cardiometabolic health as well. In terms of my educational background, my undergraduate and master's degrees are in exercise science or exercise physiology. That's why most of the work that I do is pertaining to physical assessment, performance, and fitness testing type scenarios. But when I was a graduate student, I really started realizing the importance of nutrition and proper dieting. It's like you can train and exercise adequately and appropriately 5, 6, or even 7 days a week. But if you're not dieting correctly, you will not meet your goals, whatever the goals may be, whether it's performance or health related. So my PhD is in nutrition, and a lot of the work that I have done with our team is dealing with nutritional modification. I won't be talking about that today, but I will give you a snapshot summary of just some of the studies that we have done pertaining to dietary interventions with firefighters. And so here's just a handful of a few of our studies. These are available, and if you'd like to read more about these, I'm happy to share those with you. You can request that after we're done today. But in summary, we've done things like dietary carbohydrate restriction or low carbohydrate dieting. We've looked at intermittent fasting or time restricted eating. We've also studied different dietary supplements like the use of dietary antioxidants, or sometimes we've looked at nutritional ingredients that are commonly found in like pre-workout or energy drink type products to study the effectiveness in terms of performance and markers of health as well. And with many of these, we have actually found beneficial effects. The big focus of our lab right now is stress. We are studying all things stress physiology. And so our lab, what we're doing is we're measuring biomarkers of stress. What we normally do is we will look at markers found in blood or saliva and look at the relationship between these stress biomarkers and various risk factors for heart disease risk. And so we're trying to answer a couple of questions along the lines of what is the impact of these stressors and what can we do to mitigate the impact of these stressors with respect to chronic disease risk, especially heart disease risk. Most of the people that are joining today, I know, are in the fire service, but we also have some people that are not in the fire service. So let me just talk a little bit about briefly the occupation. And as a firefighter, when I think most people think of the stress that a firefighter is exposed to, I think most people think of the physical stress. When you picture a firefighter, you picture having to respond to a structural fire and conduct victim search and rescue exercises. And of course, that adds a lot of physical stress, physical challenges, which requires a lot of physical conditioning. Not to mention the fact that you've got the added mass of the personal protective equipment and the air tank or the SCBA as well that adds additional physical strain. But I think many times a lot of people forget or don't appreciate or acknowledge the impact of other stressors in this occupation, especially psychological stress, or shift work or lack of sleep itself is a major stressor. Exposure to heat, chemicals, the combination of these stressors really results in a greater stress response, which contributes to something called oxidative stress, which I'll be talking about today. And it's well known that when this happens in the body, it certainly increases your risk for developing chronic diseases, especially cardiovascular disease, but potentially other diseases like diabetes as well. So before I explain that, let me give you a brief background of what happens to the body when exposed to stress. This is the stress response or the fight or flight response, and it's actually a very beneficial response. So anytime you're exposed to stress, regardless of the origin, whether it be psychological or physical stress, you get the same response. And basically the brain is interpreting that we are about to be exposed to a stressor. And that results in increased blood concentrations of catecholamines, which is just a fancy term that describes epinephrine and norepinephrine, which is basically adrenaline. So you'll see increased blood concentrations of adrenaline, cortisol, as well as other markers of things like inflammation as well. Now, in the short term, this is a very beneficial response. You want this response because it is preparing the body to fight through or run from whatever the stressor is. So you'll see things like increased heart rate, increased respiratory rate, increased blood flow and blood delivery to our muscles so that we can get through that stressor. In the short term, it's beneficial, but if you have long-term repeated exposure to these stressors, you end up with this long-term elevation of these stress hormones that accumulate in the blood. And over time, that will certainly lead to increased inflammation and oxidative stress, which these factors are pretty well documented in their role for developing cardiovascular disease and diabetes. So we want to mitigate and reduce this effect. Now, what is oxidative stress? Most likely, most people joining today probably aren't too familiar with this term. Maybe you've heard of it. Most of the time when I ask people, have you heard of oxidative stress? I kind of get mixed results. But when I ask people, have you heard of a free radical? Most of the time people tell me, yeah, I've heard free radicals are bad for your health and they can cause premature aging and cancer and different diseases. And there is some truth to some of those statements for sure. But actually, free radicals are good in the short term in the appropriate amounts. But if you have excessive and intense exposure to stress, your body produces excessive amounts of free radicals. And when your body produces excessive amounts of those free radicals from stress exposure, it overwhelms your body's protection against this stress, which is antioxidants. And so, when I ask people, have you ever heard of an antioxidant? What have you heard of antioxidants? Most of the time people say, yeah, I've heard, you can get antioxidants from fruits and vegetables and red wine and things like that. That is true. But the most important, most significant antioxidants are antioxidants that we already have in our cells. And they're actually triggered from moderate and appropriate amounts of stress. But when you have excessive stress, that can overwhelm our body's antioxidants and actually be problematic. And this is what can lead to chronic diseases. Now, if that is too abstract for you, I can give you a visual example of an effect of oxidative stress. We've all seen it. If you've ever seen fruits that have spoiled or foods that go rotten or metals that have rusted, those are examples of visual effects of oxidative stress. That's the same thing happening. Now, this same scenario can happen in the body to our cells. And the result is this progressive breakdown of important biomolecules that we need for optimal physical functioning. So yes, our cells or other molecules that are needed for optimal physical functioning. You can't see this effect in terms of the impact on our cells. You can't feel it, but if it happens progressively in excessive amounts over time, it is absolutely problematic. So what are the risk factors for this happening? We know that things like having a high body fat percentage or having a low amount of cardiorespiratory fitness, a lack of exercise training, or poor dietary habits, those are absolutely risk factors for it, having elevated blood markers of stress and oxidative stress. And certainly that leads to increased risk for cardiometabolic diseases. Now, there will be three biomarkers today that I'll be talking about. Those three are CRP, AOPP, and HOMA-IR. And so CRP stands for C-reactive protein. It's an inflammatory marker. AOPP stands for advanced oxidative protein products. That is just an oxidative stress marker found in blood. And HOMA-IR is the third marker I'll be talking about today, which stands for homeostatic model assessment for insulin resistance. That's a diabetes risk marker. So collectively, you could think of the first two as being indicative of risk for cardiovascular disease. and HOMA-IR as being indicative of risk for diabetes. We certainly want to reduce these biomarkers in the blood. If you have a long-term elevation of those biomarkers, especially AOPP and CRP, it leads to this process of atherosclerosis or atherogenesis. And this is when you have, over time, a progressive accumulation of plaque buildup inside of the blood vessels. So think of this as being a cross-section. You're looking inside of a major blood vessel. This could be a major blood vessel that supplies the heart or supplies the brain. If you have this progressive, again, atherosclerosis or plaque buildup inside that vessel, once you have a significant amount of blockage, let's say the vessel becomes 70 or 80% occluded or blocked, now you take that individual walking around with a blockage and expose them to intense stress from an intense medical or fire call. They have increased risk of depriving those vital organs, the heart, the brain, of blood flow. And that's when you have increased risk of heart attack or stroke. So what can you do? Absolutely, the best thing you can do, it's well documented, regular exercise training protects against that effect. They've done a number of studies. We've done some in our lab and numerous other labs as well. People that engage in regular exercise training are better protected against those adverse effects of intense stress. So that's the background. Now I'm going to move to more of the meat or the bulk of the talk today and tell you what we've been doing in the last couple of years. I've been working with Dr. Steve Martin at Texas A&M. He's the Associate Director of the Sidney and J.L. Huffines Institute for Sports Medicine and Human Performance. And he's been conducting annual fitness and health assessments for a variety of departments in the Bryan and College Station area, not limited to firefighters, but a number of departments. And our lab has come in and we've collaborated by adding those biomarkers. We've added biomarkers of cardiovascular disease risk to examine the relationship and what is the impact of physical fitness, markers of physical fitness on those biomarkers of cardiovascular disease risk. So I'll be sharing the results of just a couple of studies, and this one was just released in last year, and so it's a pretty new study. What we did here is we took two groups of firefighters. We had roughly 25 or 30 in each group, and so we had a group of HF, which is high fit, and LF, which is low fit. The high fit firefighters had a higher amount of cardiorespiratory fitness or cardiorespiratory conditioning. So you could think of that group, the HF group, as being most likely the more exercise trained group. The higher amount of fitness, which is demonstrated in that group, suggests that they're most likely more trained, especially from a cardiometabolic standpoint. The low fitness group had a lower amount of fitness. And what we wanted to do is examine the difference between high and low fit firefighters with respect to these biomarkers of heart disease risk. So here we're showing insulin and HOMA-IR. And again, collectively, these are actually markers of diabetes risk, type 2 diabetes. What we have seen, is significantly lower concentrations of insulin and HOMA-IR in firefighters that are more fit. And when you look at the biomarkers of heart disease risk, CRP and AOPP, we saw the same thing. Significantly lower concentrations of those biomarkers of cardiovascular disease risk in these career firefighters that have a higher amount of cardiorespiratory fitness. A follow-up study, we took a larger sample and had a group of 98 career firefighters, and we ran a different statistical test where we looked at correlations to determine what are the predictors of elevated biomarkers of cardiovascular disease risk. And what we found is the three major predictors of the elevated biomarkers of heart disease risk were having a low amount of cardiorespiratory fitness, having a high waist circumference, and having a high blood triglyceride concentration. So these findings just complement the findings from our previous study and underscores the importance of maintaining a high amount of cardiorespiratory fitness in firefighters. But a key point is that you can be highly fit, highly conditioned, but still have an elevated risk for chronic disease as well. So that just reinforces the importance of having this type of testing done on a regular basis. One interesting finding that we also noted were and I've been working with Dr. Martin for the last couple of years, and just as a change that was noted from 2021 to 2022, we saw significant improvements in cardiorespiratory fitness in this group that had this annual testing done from 2021 to 2022. And that's a meaningful change, and it's likely due to changes in physical activity, but we aren't fully sure yet because we're still in the process of analyzing those data. But I did want to share this. I think that's an important point. Another important point is, while increasing your fitness and conditioning reduces your risk for chronic disease, it certainly translates to improvements in occupational performance as well. And I mean, there's data going back to the 80s showing that if you increase your muscular strength or muscular fitness or cardiovascular fitness, that translates to improvements in occupational performance in firefighters. So there's a number of studies from our lab and others. We did one just a couple of years ago where we looked at air efficiency and found that fitness measurements such as low body strength and treadmill time to exhaustion during a graded exercise test were significant factors in translating to improvements in performance during simulated fireground activities. So I have two recommendations for you. Number one would be to mandate regular exercise. And in terms of the minimum recommendations from ACSM and the CDC, it would be at least 150 minutes of moderate intensity aerobic activity every week, and at least 2 days per week of strength training activities that involve all major muscle groups. Recommendation two would be to conduct annual health or fitness assessments to obtain a better understanding of the health, fitness, and disease risk profile of your personnel. So looking forward, we always maintain an active research agenda. We've got a highly active, very great group of individuals that work with us. We're always looking for research participants and fire departments to collaborate with. So please don't hesitate to reach out for more information. I'm sharing my contact information here. You will also see all of our contact information at the end. If you'd like more information on anything that you've heard today, there will be an opportunity for questions and answers, but I'm also interested and very excited to continue the discussion beyond today if you'd like. So I'm going to now turn it over to Dr. Martin, who is again the Associate Director of the Sidney and J.L. Huffines Institute for Sports Medicine and Human Performance at Texas A&M. And he has been conducting these assessments, and he can talk more about the actual tests that were done and the importance of those tests.
Thank you, Matt. And so, like Matt said, I kind of have multiple hats. I'm a clinical associate professor within the kinesiology and sport management department at Texas A&M, and then also serve a role as the associate director for the Sidney and J.L. Huffines Institute for Sport Medicine and Human Performance at Texas A&M, where a lot of our work is performed. There's a snapshot of our facility. It's going on 8 years now since we moved in. Half of the facility is a weight room with athletics. The building is called the Player Development Center, and then our lab is in the other half of the building there. And I wanted to highlight, this is a snapshot of one of the main areas in our lab. And the reason I put this up here front, I think, which makes our program a little bit unique. We have 4 or 5 different stress test systems that really make it convenient for the fire department with our ability to handle a high throughput. That's important when we're dealing with departments with 130 to 150 individuals with 3 different shifts, and we're able to run through anywhere between 13 and 15 firefighters in a 2.5-hour block of time when we perform our testing. It's a little bit more difficult for hospital-based systems that may not have the luxury of having the amount of equipment that university labs typically might have. And of course, our program was founded by my predecessor, Dr. Stephen Krause, the exercise and clinical testing program in 1985. So Matt was kind of giving a little bit of background about himself. I've been involved in testing first responders and specifically firefighters for 27 years as a graduate student. I came into the program working with the departments and have maintained that relationship now as a faculty member. So we offer both exercise and physiological testing and health assessments to pretty much anybody and everybody. So individuals, corporate clients at a very reasonable price. And part of our work with our first responders emerged from what we were trying to provide with our mission statement to the general public in finding a need for the specific group of populations that have seen this an increased risk for heart disease compared to the general population. And the twofold here is another important aspect of our program is that we provide an important educational opportunity for our current A&M students in the kinesiology and sport management department, not only undergraduate students who are focusing on more of an applied exercise physiology track that learn about electrocardiography, stress testing, performing cardiovascular assessments, but also our graduate students who have an interest in the clinical aspect of physiology. All these students take coursework and lab work and how to perform all these variety of different tests with their core curriculum. And then part of our ability to perform these tests for the departments is a practicum course. So we have a tie, an academic tie, and also service tie to the department and the community. So it works out well and it benefits the departments. We can provide these tests at a low cost, but yet our students now get really important live experience working on honing their skills before they go out in the real world and decide what they want to do with the rest of their careers. And part of that response of looking at providing this type of testing to the community and the general population, then focus a little bit more on first responders in the Bryan College Station area. And my predecessor had reached out because of some of those statistics about sudden cardiac death being the #1 cause of line of duty deaths. And so, of course, we have worked with a variety of different first responder groups, both fire departments and police departments within the Bryan College Station area, which is kind of highlighted on our screen. And of course, our physiological assessments that we are performing, we hope to use that information and hopefully identify these individuals' risk for heart disease, but also twofold, assess their physical fitness levels. So we're providing some medical information and cardiovascular disease risk assessments, but then also giving them, think of fit for duty, also giving them information back on their physical fitness levels. All of the information is only provided back to the individual firefighter. I give the administration a group de-identified response. So the department as a whole, these are what your values are. Nothing individually is ever submitted to the higher ups. Each year we sit down. I just sat down with the Bryan Fire Department actually yesterday. The timing was perfect. And we have annual discussions on their needs and what interest they have for the variety of tests that they want performed for that particular year. So we sit, I have a panel menu, so to speak, of options, and we go through it and we look at #1, budget is an important deciding factor. Each department that we work with typically has their own budget. I could say we've been blessed since 1985 that every chief that has come through in both the police and the fire departments have been very big proponents of health and fitness, especially the type of testing and screening that we do. So it's worked out really well. And then they've always made it important to them to carve out a specific budget within their department for annual fitness testing, annual health screens with our university and our lab, which is important. And then we sit down, excuse me, and have discussions on, well, what type of blood tests would you like this year? Any type of particular additional types of screenings would you like performed? We try to follow and mirror the 1582 and look at what is recommended from there, and then work a little bit amongst ourselves on different options that meet their budget. And then we set that up before we even begin our testing. So that's how this whole idea of how do we work things out. They have to have their own budget, and we sit down and we provide a menu option and look at needs for that particular year, and sometimes map out a 2 to 3 year time period of we're going to do this year, and then we'll rotate, and every 2 or 3 years we'll add this test back in, and we set that up and we give them a price. At the end, we always have a comprehensive report and follow-up consult that we can provide in groups. And then the comprehensive report goes to the individual, and a group report goes to the department summarizing the whole group's results. So this is a snapshot of the variety of tests that are included. I'm going to go through these individually to kind of give you an idea of the breakdown of what specifics are important. But we have everything from blood chemistry analysis, lung function testing, strength and flexibility, work with a physician and get an exam and a health and physical, a Q&A, cardiovascular testing that Matt had mentioned, body composition assessments, also private health consultations if needed. So all of those are included in our package price. And then we have additional add-ons that we will talk to them about, different types of blood assays that they might be interested in, chest x-rays, hearing, vision testing, or just all a la carte type of options that we can include. So blood chemistry analysis, our typical package comes with a standard lipid panel, standard complete metabolic. We have added a hybrid liver and kidney enzymes that we feel is important. So that's unique for our program. To look at stress on those two particular organs. We try every year to have mass blood draws. We go down to you at the department and A shift, B shift, C shift, and provide, give one shot to provide blood draws for as many people as they can get to show up that day. So when they come to the lab for their fitness testing, nobody has to be completely fasted. So they can have a little bit of food in their stomach. And so that works out well on that aspect. But the second aspect is all that lab results then are there for their consult with the physician, so they can go over and discuss any of those results that may be a little bit abnormal or red flagged. And honestly, when we sit down at the table to discuss what they want, we can draw and run any test that clinical pathology labs can provide. Sometimes we've used an additional lab in town based off of the particular test that they're interested in if one doesn't provide that. So if a lab can do it, we will draw the blood and we will have that test run. So it's up to the department, and then that's giving us some recommendations on maybe what they might want to look at specifically for their group or that population. Pulmonary function analysis goes without saying, the exposure to the different carcinogens. We've had groups from the Bryan Fire Department that were at ground zero that we were monitoring before they got a chance to put on specialized HEPA filters and monitoring their lung function for years post when they return back. So we look at forced vital capacity, forced expiratory volume in that first 1 second. So measures of obstructive pulmonary disease that we might be able to pick up. Interesting for our students, we picked up a case thinking about long COVID, and especially after the pandemic, but we had an individual that in conjunction with his physical exam picked up some bleeds after a respiratory infection, and turned him away and had to go get a chest x-ray and had a lower left lobe lung collapse, and a couple of weeks later was able to come back. But that correlated well with the red flag test on his pulmonary function. And I mentioned the exam by the physician. So our group has worked with local physicians. We started the program with a cardiology group at Baylor Scott and White, who worked with our department as a service offering to come out. We do pay them to come out and provide these exams, so they're not offering that for free, but at a very low cost. And since then, we've worked with a variety of either cardiology groups, sport medicine fellows, and family practitioners that will come and sit down and provide this station during our test days. So they do a typical health and physical Q&A, fill out some paperwork. Then they go into an actual physical exam. They'll listen to lung sounds, listen to heart sounds, peripheral pulse checks. We do skin checks for moles. So they'll have the firefighters, the males, take off their shirts, check their back, top of the head, surprisingly enough, looking for abnormal moles. Review all of their lab work. And honestly, it works well for the firefighter. It is basically like a doctor's office visit. They can sit there and they have the cardiologist ear, a sport medicine's ear for as long as they want during that time that they're in there. So they discuss their lab work, and we'll get older individuals that have other issues, orthopedic issues. They can take as long as they want to discuss what might be happening or what might be going on with them. And then that completes that screening before we put them on a treadmill. Body composition analysis. So we did underwater weighing or hydrostatic weighing back in the day when I was a graduate student. In 2005, we purchased our first DEXA. This is a picture from a GE model, but we went 5 years ago with Hologic. So we do DEXA scan, which is the gold standard for body composition analysis. So you're looking at now we can tease out and look at lean mass separately from fat mass, separately from bone mineral content. So we can look at osteoporosis issues isn't tied to just females. I've had a few males that we've had some issues that they've had to follow up with low bone density. We do skin folds pre-COVID, circumference measures. So as Matt said about waist circumference, waist and hip ratios, umbilical measurements as well. So the nice thing about the DEXA scan analysis is these individuals have multi-year comparisons, and the printouts and the reports that they get show a timeline of year to year to year. What has happened with your lean mass? What has happened with your fat mass? And ideally, people have good years and bad years. We see, oh, your lean mass went down, your fat mass went down. We'd like you to kind of maintain or increase that lean mass. So it makes it nice, and it's a good evaluation for what might be going on in their lives. And of course, giving them recommendations for performance and where their body fat percentage should be. Interesting statistic that we talked about with another group for more sports related, but a 2-pound asymmetry difference possibly has links to injury. So thinking about when we're looking at our ability to do regions of interest with DEXA, right arm versus left arm, right leg versus left leg. If there is a 2-pound difference in that between those extremities, there is a potential for injury there, and that's been kind of looked at more closely because of ACL tears in one of the football teams in the SEC, going back and looking at the athletes' DEXA scans, and sure enough, finding these differences. So that's something that we can also provide with our variety of first responder groups. We do standard strength and flexibility measurements. So in one room, according to the 1582, we do 1 minute sit-ups, 1 minute push-ups. We have hand grip testing that we do, flexibility testing. So we do a modified sit and reach that has the ability to adjust and account for changes in arm span. Somebody that's really tall and has really long arms, to give them feedback on their flexibility. We also now have started using counter movement jumps, with force plates. So we're looking at lower body force production, where they have their hands on their hips and they jump on force plate, and we're measuring the amount of force production. There is some research that has ties to also using that and thinking about load carriage, which is important in firefighters as a first responder with all the gear that they wear and what they have to tote around. So that's something that we're going to continue to use. I know the city of Denver uses force plates and counter movement jumps extensively, and trying to get in contact with them and look at some of that data as well. And then the cardiovascular exercise testing that Matt highlighted in some of his studies. So everybody gets a resting ECG, resting blood pressure. And I will tell you that we've had over the past 8 years, a couple different firefighters that have walked in on their testing day and found out that they were in atrial fibrillation and didn't realize it. So they didn't go home. They got driven to the hospital to get evaluated and converted from that or further assessed. So that's something that's important, a use for the resting ECG. We also have the cardiovascular exercise testing. So we do the Bruce protocol. It's a standard protocol that typically we get our information in under 12 minutes. But it serves a twofold purpose. Number one, I'm using this test for diagnostic reasons. So I'm trying to see if I can diagnose or pick up underlying coronary disease in our firefighters with this test. And then the test also gives me the ability to estimate their maximal aerobic capacity, so VO2 max. I get that by their time on treadmill. How long did you last, and what was your peak time on that test And there's an equation that we can plug in and estimate your VO2 max for that. And of course, we know that the National Fire Protection Agency has suggested that a minimum VO2 of 42 mils of oxygen consumed per kilogram body weight per minute should be considered the minimum value for aerobic capacity for performing firefighting duties or fire suppression. And that typically translates to about 11.5 to 11 minutes, 45 seconds on that Bruce protocol. So that's something, kind of information that I do feed back to the department as a whole on how they performed. And that data has been published and out there on that specific value. So it's definitely well known. We try to encourage the firefighters to go for as long as they can. It's a simple and limited test. We don't stop the test until there's something medically that the technician feels like we need to terminate, or when the subject requests to stop. And the test is only as good as the effort given. So sometimes convincing individuals to not stop for whatever preconceived, oh, I hit my heart rate, I can stop. We want as much effort as possible. I do have seen drastic improvements in effort over the last 2 to 3 years, which is really good. I think the culture is changing. Cancer prevention is big now. That's the hot button topic. So to try to address some of those issues, we developed an ultrasound process with Scott and White, Baylor Scott and White here in town, where we had 4 packages that come up and thinking about the types of cancers that firefighters are increasingly exposed to. So we have a thyroid scan that we do. We have an abdominal scan that we look at liver, gallbladder, pancreas, kidneys, spleen. So the most bang for your buck. We started with that 1 year first. They also have another scan where they can look at the aorta for more cardiovascular diagnosis in nature, but we feel we give that pretty good job with the stress testing that we do. And then your bilateral carotids, there's a lot of plaque buildup in those carotids. That was something that would be important to look at. The first year that we provided that, we had one firefighter that we diagnosed with kidney cancer that was in his 30s and had no idea. The second year, we had somebody that we caught when we did the thyroid test with thyroid cancer and had their thyroid removed. So those are some of the things that I think are important. And this is kind of an indirect way to assess cancer risk by using an ultrasound and looking for that. There are blood assays. Sure, people on this listening are familiar, have heard of the IV gene test. It's very expensive, but it's specific for certain types of cancer. But there are a couple other different assays that are out there that have a correlation to possible increased risk of cancer that are available for the departments at a cost if they want to look at adding that type of test. But I think lately departments have been really concerned about that. And is there a way that we can look at providing a preventative type measure or a background or a baseline for our staff? And honestly, there's been some crazy stuff as dog sniffing that has made its way around Texas that I think we've kind of debunked that. But I think ultrasound right now is one option. There's still the jury's still out on I think IV gene is not FDA approved yet, but that is a test that people sought out, but it is quite expensive. But so that's an option, and we've done that in the past with our fire departments, and the police departments are actually interested in this option as well. Additional tests, so complete blood counts. So you see on the screen here, all these chest x-rays, audio tests for hearing are important with the siren exposure and tones that people are getting exposed to. Diabetes screen, so hemoglobin A1C, while fasting glucose might be a little bit elevated, the hemoglobin A1C gives us a longer term look at how you're controlling your blood sugar. We offer PSA, prostate tests for our males over 40. We've done hepatitis screens for baseline testing and randomly putting those in for the fire departments. Heavy metal screens for the hazmat groups. Urinalysis sometimes may work in thinking about urinary type cancers, and we pick up any abnormalities with that. We've done that before for certain groups. We picked up cancer using the complete blood count. So I've had 2 cases where we had somebody with abnormal red blood cells that came in that it was already a previous cancer survivor and it returned. That came back with his CBC. And then we also had a CBC that was used to line out an exact time of diagnosis for somebody with lymphoma that then following our testing had a white blood cell count that went through the roof, and we traced it back. Well, his count was okay when we tested it, and kind of gave them a timeline of when there might be some issues that had developed with that particular individual. So there's a variety of tests that the 1582 has recommendations for, like chest x-ray. We've done that every 5 years for one of our fire departments. I think it's listed as a baseline, and then as needed, if you felt there was an issue, to have somebody run through that. And we subcontract out for those type of testing with the hearing that we've done previously. NMR is advanced lipid subfractions. So thinking about just what you get in the standard lipid panel is concentrations. Now we can give you information about the number of lipoprotein particles that are circulating in your blood, and of those particles, what are the sizes? So the idea is, if you have the typical bad cholesterol, LDL, how much of those particles are circulating, and of those particles, what are the size? Are they small like marbles that can penetrate the intima and induce atherosclerosis? Are they big like beach balls and more protective? So that's something that the Bryan Police Department, I know we're talking about fire, but has chosen to look at for 4 or 5 years in a row. But that is on the table in a menu option for the groups. And then, of course, afterwards, every firefighter has we have software that we use that gives them a nice, concise 13-page color report with recommendations on some of the results of their test. They get copies of all the blood work, all of their lab tests that are performed for that year. They get the nice color copies sealed up and delivered to them. And then we do a group report that goes down to the department that summarizes their department as a whole. Where are we at? And we do group comparisons from year to year, what's happening with their group. And that has formed their decision making for what we're looking at doing this next or coming year with the Bryan Fire Department. And with that, I think we'll lead into, I think we have a couple quotes from the Bryan Fire Department that they were going to put on the screen. So I will pass the baton to that screen.
Right. Thank you, Dr. Martin and Dr. McAllister, for sharing your research and expertise on this subject. You know, every time I hear Dr. McAllister talk about his research on the effects of stress on the body, it makes me think how important it is for all of us to understand how to mitigate these effects. But when you add all of the stressors that firefighters face just as part of their profession, involving all of these factors that are beyond their control, it definitely makes these recommendations even more urgent. So regular fitness requirements and annual testing. Before we move into our Q&A, as Dr. Martin just mentioned, we wanted to share some testimonies from firefighters with the Bryan Fire Department who have worked with Dr. Martin and the Huffines Institute to engage in annual health and fitness testing. We had hoped that these folks would be able to join us today, but unfortunately they had we were unable to secure their time due to a scheduling conflict. However, they graciously shared a few testimonies with us so we could at least attempt to share their insights with all of you today. I'm not going to read these verbatim, but as you can see, first and foremost, the firefighters who have participated in this clinical testing program are aware, as you all are, of this major issue of cardiovascular disease in the profession. You can also see in some of their quotes here that the impact that regular testing and related fitness interventions have had on their individual performance as firefighters. And I think another thing that stands out is their recognition that there are researchers and other individuals out there who are invested in helping to solve this problem and to improve health and wellness in fire service more generally. So I want to thank the Bryan Fire Department for sharing their experiences with us, and I hope we can grow these testimonies to include more individuals in the future and really expand the impact of this amazing work that Dr. McAllister and Dr. Martin are doing. So now we will move into our Q&A session and take questions from our audience. I would like to go ahead and introduce our program specialist, Shelby Snead, who will be moderating our Q&A today. I think many of you have probably spoken to Shelby over the phone these last few weeks during the outreach of this event, so she's a familiar voice. Thank you, Shelby. And just as a quick reminder to everyone, please feel free to continue submitting your questions throughout the Q&A session. We really want this to be a conversation. And so again, please share your questions, and we're going to answer as many as we can as time allows.
All right, thank you, Jessica. Hello, everyone. So again, my name is Shelby Snead, and I'm the program specialist at the Translational Health Research Center at Texas State University, and I'm going to be moving us through the Q&A session today. First and foremost, I want to thank Matt and Steve again for the outstanding work that they are doing and for sharing that with us. And I want to take some questions from the audience. So if you haven't submitted anything in the Q&A and you had some questions, please go ahead and do that now. We will try to get to as many as possible. So to start with one of our first questions, Matt, we know that we should exercise regularly to maintain optimal health. And can you expand a little bit more on your second recommendation about how this information is different or more urgent for this population?
Yeah, so it is certainly more urgent for this population because roughly 50% of all on-duty deaths in the firefighter community are attributed to some sort of adverse cardiovascular event, heart attack or stroke. And so engaging in regular exercise testing and just regular exercise practices is especially important, not only for the physical conditioning that's required to execute the duties. You know, being there, you've got people whose lives literally depend on your physical performance. And I think a lot of times in this community, they think of the importance of training, regular exercise training, so that you can perform your duties well, but don't sometimes just forget about the importance with respect to health. And it's especially important in this occupation because of the increased prevalence of cardiovascular disease. I mean, there are things that are changing inside the body that you can't necessarily see or feel, but can be elevating your risk for disease. So it's especially important.
Awesome, thank you, Matt. Steve, did you have anything that you might have wanted to add to that?
No, I think Matt hit it on the head, and with that population, so this idea, if we can help identify the risk factors with our testing and make them aware of that. The problem is, what if we don't? And their position is they sit around and they train, but they're doing things, and then all of a sudden the siren goes off and the adrenaline dump that happens with that. So now that population that has underlying disease that may not have been picked up, and that adrenaline dump and what they have to go do, and it may not happen during the fire suppression, but an hour later after they get back, there's where that increased risk of sudden cardiac death comes in. So our goal, we can bring to light possible risk factors and lower those risk factors, improve their health because of the job and what they're exposed to, and those big swings in adrenaline, I think is important, and that's what we have to watch out for.
Awesome. All right, thank you. That was very insightful. And
I will say, I didn't get to work that in there, but literally our very first year of testing in 1985, first firefighter on the treadmill, the chief, abnormal test, next day quadruple bypass surgery. I mean, we've never lost a year with Bryan Fire Department since then. So.
Wow, okay, thank you. And so a question from our audience, has your research included the effect of radio alert tones on cardiac issues?
I have not done that specifically. I also work with a center on campus, which is the Alert Center, Advanced Law Enforcement Rapid Response Training. So a lot of the work that I do is with the firefighter community, but I have done quite a bit of work with respect to law enforcement stressors as well. And with that group, we have attempted to incorporate things like that, sounds of shots fired and radio traffic, but we haven't done a controlled trial yet to actually study the impact of those audio signals and how they can affect biomarkers. That's certainly a good point to bring up, something that can affect the response as well.
All right, and Steve, did you have anything else?
I have not done and been involved in that type of research. We've had one fire department that came through the audiometric type testing Quite frankly, you catch a lot of people that do have hearing loss, but I don't think we've tried to correlate any of that with other variables. So.
Thank you. And another question, what are some of the ways Matt or the THRC are planning to continue to disseminate this information to other firefighter groups and other interested parties that could utilize this research and possibly the testing at the Huffines Institute?
I'll go ahead. We have a number of studies ongoing, and we're looking at continuing this line of work and continuing to do things like this to share the results with the public, because in academia, we're so heavily trained to just conduct the experiments and the trials and report the findings to an academic community, which a lot of times that's not the most important community. I mean, the people of the community are the ones that need to hear this, not just the academic communities. And so we're looking at continuing this model of this type of dissemination with, webinars and town halls and such. But I've also got a project that I'm working with THRC on, which is going to be a pretty large training intervention in firefighters. And we are looking at sharing results with NFPA, National Fire Protection Association, and they have agreed to help us share the findings with their community and share the findings directly on a national stage at their conferences and such, so that we can reach the appropriate audience more effectively.
All right. And then can you tell us more about the work you've done with the Bryan Fire Department? For example, can you tell us why you started working with them or how they found out about your program?
So literally, Bryan Fire Department was our first group back in 1985 that my predecessor reached out to and established that relationship. So I think it all started with the mission of the lab at the time. I mentioned providing the low cost cardiovascular health screenings and the importance of the general population, but then also realizing my advisor and some others had an interest in the fire service in general and reached out. So I will tell you, we've had doctoral students that have left, went to different universities in different states and tried to replicate. And a lot of what you have to do, and what I've had to do when there's been new chiefs, is draft a letter and bring to light the importance and the statistics about cardiovascular disease and line of duty deaths and sudden cardiac death, and say we have the ability to help your group by assessing that with our facility at a low cost and establish relationships. And we've been blessed because it's worked and it's continued to work. It doesn't always work that way in other areas and the relationships that we have, but that's how it was initiated, was let's provide this. You're doing a service of providing our students with examples and being able to run these tests. We can provide it for an extremely low cost than when you were going out to a hospital-based system. And we'll provide all this information. We've done exercise programming in the past with the Bryan Fire Department. So that's something that they had a grant at one year. So that's where we're all started. And I'll say that we have great things and lined up for the future with Matt. We're getting really interesting live fire suppression data from the groups while they are battling and at the Brayton Fire School and getting saliva samples before and after those exertional type of trainings. And I think it's only going to go and move forward. We're going to have some exciting information coming here in the next few years, and the departments and the groups are all willing participants, and they're interested in the results as well.
Awesome. Thank you, Stephen. That was really insightful and really inspiring. And then Steve, can we, another question, how can we get our department in the clinical testing program? Any recommendations on how we might start the conversation with our department about funding or that budget you had mentioned?
So I think it comes from the top. Typically there they have, of course, your chief and then training coordinators. And I think a lot of what has happened is, deciding what they want to do for their health and wellness screenings. And honestly, I think it comes down to who is the chief and what their mindset and their goals and their interests are. We've been lucky that every chief that has come through has from other areas have had just a real devoted interest in the health and well-being of the firefighters and the interest in this type of test. And so I haven't had to sell anything to get them to work with them, and it's been great. They amongst themselves decide on budget and what they want, and what they want to do for particular years. I've had people travel from Taylor, Texas to come through and test, and we do work with Texas Task Force 1. So we'll get individuals kind of coming in from Austin, San Antonio. But I talk to them, and those places are providing health and wellness screenings of just different types. But there are some that are a little more extensive, and there's some that are just go to your doctor and that. So I think it depends. It's got to come from the administration, or maybe the firefighters or the unions themselves, and making some suggestions. We'd like to have this. Is there a possibility? And maybe looking out to the universities in that particular area and see if they have a facility like we do that is engaged in that and capable.
Awesome. Thank you, Steve. And then Matt, I was wondering if you could provide any more details on what cardiorespiratory fitness entails. Like, what exactly are you meaning when you say cardiorespiratory fitness?
Yeah, so one of the tests that Dr. Martin mentioned that he does is the Bruce treadmill test. And so it's a pretty simple test. It's usually completed in about 15 minutes or less. And what we would do is have someone run into volitional exhaustion. So they're basically running until they can't continue the test anymore. And it's a graded exercise test where you start off at a slow speed and a pretty high incline on the treadmill. But every 3 minutes, you're increasing the speed and incline of the treadmill until you get to a point where the participant can't continue anymore. And with that, the people that are more trained and engage in more exercise training on a regular basis can typically go longer on the test. So their time to exhaustion might be, 20 minutes as opposed to 16 minutes or 15 minutes. And with that, it's a very well-established test for predicting cardiorespiratory fitness. You can take time to exhaustion on that test and indicate what's called VO2 max, or you can just directly measure VO2 max with pulmonary analysis. And sometimes people lack the equipment needed to do that type of analysis. It's to have the pulmonary analysis done, it's going to require around, you can correct me if I'm wrong, but maybe about 20,000 or 30,000 for like an analyzer that would do that. But you can do that type of test and just use time to exhaustion on that test and still get a good reflection of cardiorespiratory fitness just based on that one test that was done in 10 or 15 minutes. And a lot of the results that we shared today were based on that one assessment.
All right, thank you, Matt. And then I also had another question for Matt. I think you addressed this a little bit earlier, but just to ask it one more time. Are you working on any new interventions?
So Dr. Martin mentioned that we are currently looking at the stress that's induced by live fire activities. And that's important because when I first started doing this work, I started doing this work earlier on in my career, and I was doing laboratory assessments with firefighters. And I met with this one retired firefighter. He came to my office once and he was like, yeah, that's cute. You get them in your little air conditioned lab and you're doing these tests and, AC environment, but you're not really getting them stressed until you get them into the heat induced environment. So years ago, we started looking at the effect of added heat and, can we do anything to modulate or reduce that stress response when you have a high heat environment? We would get the air temp with a controlled burn, we would get it to roughly 1,000 degrees and have them conducting their training evolutions in that high heat environment. And, it's important to study that type of thing so you can get a handle on a better idea of what is the actual physical load here and what can we do, because the stress induced by a live fire activity is nothing like what you're going to do or what you could mimic on a treadmill inside of a lab. And so moving forward, we are working on submitting a grant for a training intervention that we would do. And this particular intervention is going to use a pretty advanced virtual reality based training system that is designed to put someone in a high heat, high stress environment. This VR system has the gear that can add heat. It's got a hose that can act with resistance to feel like you're deploying a charged hose with weight. And it has these pretty advanced virtual reality scenarios. And it may sound kind of silly, like, can VR really do anything? Actually, I've got a number of studies that our lab has released recently where we've shown that VR environments can be as realistic and as stressful and as effective as real life training. So that's what we're looking at doing next.
Awesome. Thank you, Matt. We're excited to see that come to fruition, hopefully. And going into our next question, if we as a department wanted to participate in future training or the interventions you've discussed, what would you need from the department?
Is that for Dr. Martin or myself?
Sorry, that's for you, Matt.
Okay. Yeah, if anyone who'd like to participate, we will share our contact information. All we would need is just a contact. And so we can continue that discussion after today. And I'll get in touch with you. Dr. Martin can get in touch with you. And if you'll share your contact information of, your assistant chief or chief of training operations, whatever it may be, we will get in touch with you and continue that discussion to see where we can collaborate. We're always looking for new partnerships for sure.
Perfect. And Steve, did you want to add anything, any last general thoughts?
No, I think Matt, kind of hit the nail on the head. I think where we go with really looking at the stressors, and so I think we're interested in. We've got some core temperature monitors that we can put on our guys when they go back out to the fire training grounds, and when they're gear up and we're getting close to the summer, really looking at what happens and how much of an increase in core temperature is happening with heart rate and heart rate variability, and some of the samples that we're getting, looking at stressors and that to kind of help us and look back at, well, is their fitness level, is there something different about high fitness, low fitness, and how they respond to some of those stressors and their core temperature? And so I think that's important. The fire guys will often tell you is that, yeah, sure, we're hot as hell when we come out of there and seeking rehab, and then they got to go back in, and we haven't had any measures of those kind of vitals. So I think that's something that we look to expound upon with what we're doing in the lab, and kind of taking it and moving that out to some live training.
Awesome. Okay. Thank you so much, both of you. And I think that about does it for the Q&A. I want to thank again our presenters, Matt and Steve, for those insights. And thank you to the audience for submitting the questions. I'm going to turn it back over to Jessica Schneider.
All right, y'all. Yeah, that was really great. I want to circle back very quickly to a question that someone asked about what THRC is doing to help disseminate this research to the firefighter community. So this webinar is a good example of our efforts to just get the word out about this work and invite people to the table who both need this information because their lives are impacted by this research that is being done at these universities. However, I would also add that a part of this our research efforts is also, and bringing everyone here together today, is really about starting a conversation. THRC has a core mission to improve community health and resilience in the state of Texas. And so we're working really hard to build this resilience network across the state, where we can bring together researchers, practitioners, policymakers, people who actually work in these professions, so we can learn from each other and hear about the needs or problems that y'all are facing. And the only way we can do that is to start with these sort of launching pad events, I would say, that bring people together. So for that reason alone, we're very grateful that you all joined us today. And we hope this information is a helpful starting point to a larger conversation. As we transition to the end of our webinar, I want to again thank our speakers, Dr. McAllister and Dr. Martin, for sharing your work and your experience with us today. I also want to thank our audience which is largely composed of firefighters from all across Texas who certainly understand the risks and the issues surrounding cardiovascular disease in their field. I also want to give a shout out to the researchers and other individuals in our audience who are invested in helping to solve this problem of cardiovascular disease in this community. I hope you all can take this information back to your department and share these recommendations with your team and with your colleagues. So we all know how important exercise is to our health and well-being. But when you're talking about our first responders, you know, the folks who are first on the scene to help our communities face and overcome emergencies of all kinds, the idea of health and performance takes on a whole new meaning, not only for the individuals who are out there doing this work, but for their families, for their team, and at the end of the day, for their communities. I want to reinforce something that Melinda said earlier in her introduction, and that is that in the Translational Health Research Center, we know that healthy and resilient communities need healthy and resilient first responders. So based on what we learned today, a first step in fostering resilience is just implementing these simple yet evidence-based recommendations that can improve the health and performance of our firefighters. To reiterate Dr. McAllister's recommendations, implementing regular exercise requirements in your department and conducting annual health and fitness assessments can make a huge impact on the health and performance of our first responders. So these recommendations can help reduce their risk of cardiovascular disease at the individual level, but I would also argue that it can help foster resilience at a community level. So in closing, we don't want this to be the end of this conversation. So if you are interested in sharing your experiences or in participating in future research or in some of the interventions that Dr. McAllister and Dr. Martin discussed earlier, again, these interventions that aim to expand our understanding of this issue and our approaches to help reduce the risk of cardiovascular disease among firefighters, please reach out and join our growing firefighter resiliency network. After we conclude today, you will all receive an email with a survey, as you always do at the end of a webinar, but this is going to ask you not only about your experience with this webinar, but it's also going to ask if you would like to opt in to our resiliency network for future webinars or opportunities related to this topic. We cannot have this conversation without you. So please complete this survey to help us continue this important conversation and help us learn from your experiences. Also, if you didn't get your question in today, please feel free to reach out directly to Dr. Martin or Dr. McAllister. Their contact information is here on the slide. You can also reach out to us and we can share their information with you, and they can provide additional information about their research and their services. So in conclusion, thank you again to all our speakers and to all of you for joining us today. Thank you especially to the firefighters and first responders who are with us today for your amazing work and everything that you're doing to support our communities and to keep them safe. We appreciate everything that you do, and thank you so much. We hope to hear from you soon. Thank you.